Hello everyone, I am the student of final year BMS, Sharda Ayurvedic Medical College, representing your topic of cleft lip and cleft palate. The contents include embryology and surgical anatomy, types of cleft lip and cleft palate, incidence and etiology, clinical features, initial management, surgery, beyond cleft lip and cleft palate corrections. Embryology and surgical anatomy of cleft lip includes: at fifth week of gestation, a structure called nasal precord gets converted into nasal pit. Around nasal pit, the two processes are formed. One towards the median side called as median nasal process and one towards the lateral side called as lateral nasal process, with two eminences, namely maxillary eminence and mandibular eminence. The two median nasal process starts to grow towards median side and form single fused median nasal process, but the two lateral nasal process remain unfused. Single fused median nasal process fuse with maxillary eminence and form upper lip, and two lateral nasal process form the two ala of the nose. Next, the embryology and surgical anatomy of cleft palate include: the hard palate formation mainly involve two structures, that is primary palate and secondary palate. The orange color represent the primary and the blue color represent the secondary palate. The fusion of primary and secondary palate leads to the formation of hard palate. The junction between the primary and secondary palate is called as incisive foramen. Any defect in this process can lead to cleft lip and cleft palate. The incidence of cleft lip and cleft palate include 1:600 ratio of live birth. The types include it, or if only the lip is affected, it is called as cleft lip, and both lips and palate is affected, it is called as cleft lip associated with palate, and it is most common. And cleft palate, it occurs more in male compared to female. The types of cleft lip includes: the first image represent normal, second unilateral cleft lip, third bilateral cleft lip, fourth simple, and fifth compound. In unilateral cleft lip, the defect in the fusion of maxillary eminence with median nasal process on one side. In bilateral cleft lip, there is defect in the fusion of maxillary eminence with median nasal process on the both sides, whereas simple and compound cleft palate include the involvement of alveolus. It is also known as tooth socket. If it is involved, then it is compound, and if it does not involve, then it is simple. The types of cleft palate include: first image represent normal, the second image is unilateral cleft palate, third image bilateral cleft palate, fourth image cleft lip and palate, anterior palate on one side, fifth image cleft lip and anterior palate on both sides, sixth image bilateral cleft lip and cleft palate with full palate is involved. Etiology: family history, maternal drug intake, that is antiepileptics, steroid, teratogens are also involved, associated with other syndrome, Pierre-Robin sequence, Down syndrome, Tucker-Collins syndrome. Clinical feature includes feeding difficulties, speech problem, dentition defect. Initial management is done by correcting the nutrition, special nipples and bottle feeder with one-way valve, specially for cleft palate, and securing airway has to be done. Further management is done by the surgeon before the surgery by pre-surgical infant orthopedics, that is PSIO, with naso-alveolar molding NAM. The second image represents the naso-alveolar molding, which is inserted into the child mouth and secured with the tape. Around the nasal molding, the skin and the other structures are formed by narrowing the cavity in cleft lip and cleft palate, making it very easy for the surgeon to conduct surgery. Millet criteria for the surgical repair. It is also known as rule of 10. For cleft lip, the weight should be 10 pound, age should be 10 weeks, and hemoglobin should be 10 gram. And for cleft palate, the weight should be 10 pound, age should be 10 month, and hemoglobin should be 10 gram. Surgeries, timing of repair, cleft lip alone 5 to 6 months, cleft palate alone. For soft palate it is 6 months, for hard palate it is 15 to 18 months. Surgery goal include to achieve the normal appearance of the lips, nose and palate, to normalize the speech, feeding and dentition. The principle of surgery is cleft lip surgery, skin incision to align the displaced tissue. Muscular continuity is achieved by suturing the muscle to nearby bones. Horizontal fibers of orbicularis oris are then sutured. A functioning oral sphincter is achieved. Surgery is principle of cleft palate, reconstruction of soft palate musculature if soft palate is involved, closure of hard palate cleft if hard palate is involved, and it has to be done when both the palates are involved. Minimize the amount of dissection and thereby scar formation for better results. Surgeries. For cleft lip, the two major surgeries are Miller repair and Tennyson Z plasty, and for cleft palate is Warden-Wigner repair, von Langenberg repair, Furlow palatoplasty. It is also known as Z-plasty technique. Beyond cleft lip and cleft repair, hearing is also be managed. Increased risk of otitis media, that is the middle ear is infected. Increased risk of conductive hearing loss and sensorineural hearing loss. Screening for hearing loss with BERA and tympanometry before 1 year of age. For speech assessment as early as 18 months, repeated at regular intervals. Velopharyngeal insufficiency, that is nasal speech therapy, palate surgery, speech training device can be used. For dentition, various dental anomalies can occur. Good dentition is maintained by preventive measures. Orthodontic treatment is done. Thank you.